There are 351 beds for forensic psychiatric patients in Croatia. This capacity is used for persons who have committed the crime but were not responsible for it because of psychopathology of mental illness. Under the law, for persons with mental disorders, they are called incompetent persons. They are placed in forensic psychiatric wards for involuntary treatment. The biggest institution for general and forensic psychiatry is in Popovača, 63 kilometers east of Zagreb. In 1934, psychiatrist Dr. Ivan Barbot founded a psychiatric hospital that bears his name in the former castle of the noble family Erdődy in Popovača. The hospital has about 650 beds and 200 beds for forensic psychiatric patients. What is forensic psychiatry? Forensic psychiatry is a branch of psychiatry that deals with legal issues related to mental disorders. Forensic psychiatric experts conduct expertise of persons with mental disorders who have committed an offense or are suspected of doing so. Forensic psychiatry comes in contact with legal norms of criminal and civil law. At the Institute for Forensic Psychiatry in Popovača and in all 4 institutions in Croatia for the treatment of mentally ill persons, forensic treatment program is carried out, including psychological, pharmacological, and socio-therapeutic treatment. The clinical goal is reduction of psychopathological symptoms and reduction of psychological suffering. The second forensic psychiatric goal is a change in behavior of people in forensic psychiatric treatment that reduces conflict in the treatment and develops socially acceptable forms of behavior. The third goal is to reduce the risk resulting from the disease for the patient and for the safety of others. Forensic goal is determined by the law to reduce the risk of violent and other risky behavior. The fourth goal is rehabilitation and social reintegration of forensic psychiatric patients and return to the local community. The fourth goal is the longest and the most difficult part of psychiatric treatment. The program begins with a comprehensive diagnostic evaluation, psychological, laboratory, EEG, EKG, internist, social report, etc., and a plan of treatment for each individual patient. Patients are involved in individual and group psychotherapy, family psychotherapy, social therapy, and occupational therapy. The working model is based on a process model of human behavior that takes into account the patient's psychological, emotional, and social abilities as well as their physical status. For therapists, it's a good source of information in monitoring the functioning of the patient in forensic treatment. Access to the patient and planning and performing the treatment is individual and takes place according to predetermined residual cognitive and behavioral characteristics of the individual patient in treatment. What is the problem? Patients undergo the whole treatment achieving the set goals in shorter or longer period. The rehabilitation and social reintegration of the patients are most difficult. In most cases, there is a double-bind syndrome. The patients who cannot be released, together with their families, request release, while the patients who could be released have nowhere to go and no one to stay with, as there are no post-release facilities in place. The pressure coming from the patient's families and sometimes from the judge is that the patient is released because of long stay. However, long stay is not a sufficient reason for release. Even when the patients are still in treatment, there is a risk of reoffending. If the patients do not have adequate post-release accommodation, care and monitoring, the risk is extremely high. Some patients might be released because during treatment the risk has been reduced, but if there is no adequate post-release care, the risk will increase. The risk assessment for such patients is never good. There is a high risk of reoffending. A lot depends on the community support, from accommodation, medication, psychiatrist checkup, aggressiveness control, to finding a job and emotional and psychological stability. The social stigma of forensic psychiatric patients is high.